I'm trying to record a podcast.
Hey, everybody. It's Angela Ardolino with Your Natural Dog. And my guest today is Dr. Lauren Beaird. And she is a young veterinarian that immediately got out of school and realized she didn't really learn about healing or any natural modalities, and immediately started to learn and become an outspoken advocate for the industry and speaking up about what she learned and what she didn't learn. So we're basically going to debunk some myths that we're told or what we think, and kind of what really goes on when a vet goes through veterinary school and what they are taught and not taught, and our opinions on why. And so stay tuned. It's a really interesting conversation with Dr. Lauren Beaird when we come back.
And know that I am giving my dog something that is 100% natural and has virtually no side effects. I can't wait to create, more experiences and make new memories with my dogs, knowing that they will be able to stay calm and enjoy every single moment of it.
Hey, everybody. We're back with Your Natural Dog and my very special guest, Dr. Lauren Beaird. And you were one of those kick-ass, cool, young veterinarians that got out of school. You know what you are, and why I think I like you so much? I feel like if I would have become a veterinarian, that I would be you. Like, where you were like, this is what I want to do. I don't care, no matter what. You get into school, get out of school, and go, gosh, I don't know anything. I don't know anything about healing or natural healing, or why didn't I learn about that? What was that experience like in school? Like, it's strange because I'm like, there was like a part of me at one point that regretted that I didn't become a veterinarian. And now, of course, I don't regret it and feel lucky. And then I'm so grateful for people like you who come out and speak up, because we know, how many veterinarians get into this to co-help animals and then realize that they've spent all this money to go to school and they still can't help animals, and why we have such a huge suicide rate with veterinarians. It makes sense to me. And what's happening and why this is so important and why we need to talk about it is because we're losing the good ones, not the ones that get in to make money, not the ones that get into it so that this is a career. We're losing the ones that got into it to help the animals in the first place. And there's nothing to me more heartbreaking to think about that person in school. Yeah. And putting themselves through school and being in debt. I know vets who are my age, around my 50s, and who are still paying off student loans. That's insane. And, my generation, they're working 60 to 80 hours a week and cared. That's not happening anymore. We're going to have a huge shortage of not only veterinarians, but the really good veterinarians. So I'm hoping, we're going to have more people like you who are going to come out, who are going to empower the pet parent, going to tell the truth about what you do learn and what you don't learn in school. And I think it helps us also as pet parents to know what to look for. You know, if you see that veterinarian who is doing acupuncture or chiropractic or food therapy, 9 times out of 10, they have gone out and have educated themselves, continued their education so that they could truly learn how to heal animals. Am I right?
Right.
Am I on point? Yeah. So tell me what it was like.
I think so.
Like, did you get into year 2 and go, okay, maybe next year I'll get to learn about the good stuff?
Well, I don't know that I had the right mindset going in. From the start, like when you start the application process for school, one of the biggest things people tell you is like, it's like drinking out of a fire hydrant. Like, just get ready to just be overwhelmed constantly. So before you're even in school, you're already ready for information overload. And it's like, you don't even have time to question what you're being taught because you're in class, 10 hours, 8 to 10 hours a day. And then you go home and you study until you fall asleep and then you repeat. And it wasn't until I really graduated from veterinary school and I looked back and I had clients asking me, I don't trust Apoquel. It's a new drug. And I'm like, oh, but it's safe. And I started hearing myself regurgitating what the drug reps came in and said. And then I started questioning these other little things that happened throughout vet school that made me so comfortable with using certain pharmaceuticals, but really made me hesitate when anyone brought in a bottle of fish oil and asked me to check it, let alone anything that contained CBD in it. There were just so many things that were taught to you, like you use this med for this problem, and it was painted as a very black and white picture. But as soon as you get into actually trying to help people in developing relationships, you realize people don't want this textbook answer. They want something for their pet. And so that takes thinking outside of the box, and it takes releasing your ego, which you develop whether you mean to or not, kind of as a protective mechanism.
Well, I mean, if you spend $250,000 on an education, I think that you're entitled to have some sort of ego that you know what the hell you're talking about.
Well, that's what they want. That's what they want you to think. When you really stop thinking that way, or at least for me, because I don't want to speak for everybody, but my experience was there was a few things that really changed me. And there was a couple of clients that I did not expect to break down over vaccines. And I was like, I don't understand why this is so stressful for you. We really do separate things and individualize things. My first practice was great that way. But he was like, you don't understand. I don't do this for my children. I don't want to do it for my dog. And it was just this guy that I did not expect to have this conversation with. And it really got me thinking for the first time, well, why is he so scared? I was told this is totally safe. Or why are people questioning these dog foods? They're great. They're researched. It wasn't until I started questioning, well, have I really looked into these things myself? I don't really have the time, but people want to know more. And then my own dog got sick and I was like, okay, I'm done with this. This isn't how I treat myself. So things changed for me really rapidly from there. And there's just so much in hindsight that I looked at vet school and I was like, what my dream is to help people and animals. And I felt like I was more so making sure they were becoming a recurring client in some ways. Not that it wasn't intentional. Right. It just happened that way. And I didn't feel like I was ever helping anyone because they kept coming back for care every 4, 6, 8 weeks, rather than being able to empower a family to learn how to really take care of a pet. And a lot of it is just common sense and listening to your gut. And most people feel like they can't speak up with their vet. And that's one of the things that I've always I've been working on trying to do is make sure that people can question me and they don't feel like I'm an authority figure. I'm part of the team.
Right. And I think that's a beautiful thing. To me, it seems like from my, I've interviewed so many holistic and integrative veterinarians. I feel like the schools are teaching you how to write a prescription. They're teaching you anatomy, physiology, surgery, how to cut things out, how to put things back together, and then how to write prescriptions. Because my own journey with my dog is I took her in because to my vet, this was 20-some years ago, my first bad experience. And I took her to the vet because she had diarrhea and was throwing up, and my dog was dead a year later. And that's because They didn't know what to do. They're not taught about diet and nutrition. And it was a conventional vet office. I took her, it opened up across the street from me. So I did everything wrong. And I know that now. And I also have learned that question everything and don't put anything in somebody else's hands. Research everything. Everything that comes out of my mouth and is on this podcast, look it up for yourself and verify it, because there is so much information out there and most of it is skewed for you to buy or depend on a pharmaceutical drug. And that is what happens. You get prescribed a pharmaceutical. You have to come in every, 2-4 weeks to get a blood test to make sure that that pharmaceutical isn't killing your dog too fast. I mean, it's like it's perpetual, you know, you're always coming in. It's almost, I always like to use the example of when I discovered that the chemotherapy drug cisplatin is made from platinum. And that platinum kills cancerous cells, but it also kills the good cells, healthy cells. Silver, on the other hand, only kills cancerous cells and not the healthy cells. So why aren't we using silver? Why? It's almost like, well, we can get more money. We have a patient. Do you know what I'm saying? It's just like the do no harm doesn't exist anymore. It's a standard of care. You have this, this is the protocol, doesn't matter, individual, you know, everything else. And then all the other things that are operating against veterinarians where constantly being introduced new drugs and touting what they're supposed to do. Yeah, Apoquil, everybody was like so thrilled with Apoquil. Apoquil's supposed to be used for 1 to 3 days and then stop. And it's being used on a daily basis for most dogs.
Right. Long term. And the studies, I think they called it a long term study, but I want to say it was about 6 months. And most dogs are on it forever because people see response. Right. And actually, that was one of the drugs that got me really thinking, because our drug reps were great. They were super nice. They came in, they bought us food. There was incentives to sell things. I'll never forget the first time I called. Very uncomfortable with that.
A vet office, and they were like, "Absolutely, we'd love to do a lunch and learn with you." I didn't know what a lunch and learn was.
Oh,
I was like, cool.
For the lunch.
So I showed up, and they were like, "Well, what are you getting us for lunch?" And I was like, "Oh shit, am I supposed to?" I'm not bribing you guys. I'm teaching you about the endocannabinoid system. I'm not bribing you so that you buy my product. I'm just here to educate you.
That started in veterinary school. That was like something that we just kind of assumed was how it worked. You know, a rep came in, they bought you lunch, you learned about the products. Now you were safe. It was a safe thing to use because they said so. But I actually had a Yorkie. She was 15 and incredibly itchy. And we were talking about options, and she was older, and I was hesitant to do prednisone. I was like, well, there's this new medication on the market. Within 2 days of starting it, her lymph nodes were huge everywhere. She had multicentric lymphoma. And one of the side effects of Apoquil, or you should never give it to an animal with cancer. She had no clinical signs of cancer, but I'm sure her immune system was just barely hanging on. And I got on the phone with them. Deny. I'm like, but even in your package insert, like it says that's a possibility.
Neoplasia. What is it? Plasia?
Yeah, 20% of your dogs ended up with tumors or masses on them that were in your trial. Like that's all written in the fine print that nobody read. I didn't read it till I had a bad experience, and then I was like, oh my gosh, like you really can't trust anybody else. And as a veterinarian, I don't ever want to tell people what to think. Like just because I think this might be best for your dog, I want you to really think, like, how should I think about this? What questions should I ask? What do I need to go home and research? And yeah, that creates a lot more dialogue between people. You can't see as many pets, and it's not a great business model. But ultimately, I sleep a lot better at night. And you were mentioning the veterinary suicide rate, and this morning another post came up on my Facebook, and it was another vet who took her life that people had no idea she was struggling. And I made myself a promise as soon as I graduated that I would never let myself get there. I would leave the profession. I would figure out the student loan thing. It wasn't worth that. And then I realized there's a way that was more like a way to practice medicine that was more in harmony with like what felt right for me. And it was a leap of faith, and I have so much to learn, and there's so many really well-established veterinarians that provide kind of integrative or like solely holistic medicine isn't even the right word, I guess, at that point, but care for your pet. And it's wonderful to have resources even like this podcast, because I get to learn stuff from other veterinarians or pet professionals that I never would have heard otherwise.
Thank you. And thank you for being so outspoken so that people can hear it from the mouth of someone who just went through it and has got to figure it out now. You know, what is your path? And I love it because you're taking the natural path, which is the name of your website, the natural path. And I can't wait to see what you're going to do and come up with, because you have figured it out and now you know how to move forward. You know, no matter what you're doing, it's going to be done with intention and healing, because that's what you want to do. And I think there's a lot of vets like that. And again, it's going to be hard, and we're going to have a shortage. And the good thing is that I know people like you, you know, we've got several now who are empowering pet parents. They're telling them the nitty gritty. They're telling them the truth. What I love is that I can interview someone like a Dr. Ruth Roberts or Ava Frick or Judy Morgan, who've been practicing holistically for 30 years. And then I can come to someone like you who's right out new and learning that this is an issue. It's been an issue for that long. Yeah. So you speaking up about it hopefully will create change. What about, like, what happens? So you graduate, you become a veterinarian, you get a license to practice veterinary medicine, which literally gives you the permission to write a prescription drug. What happens if you don't ever write a prescription drug? Do you still have to? So you have to be licensed to practice?
Oh, yeah.
Do you know what I'm saying? Like, it makes me go, I call it things that make me go, I don't know if you remember that song from the 80s. But I'm always saying that. Things that make me go, what happens if I open up a school, an all-natural school, and we just teach it? Well, kind of like the Chi University has done. But you have to be a veterinarian to go to the Chi University.
Like a naturopathic school, where it's a totally different degree.
So what? I don't care. I don't get to write prescriptions, but I still get to practice natural healing. That doesn't even exist. That's not even allowed in this world without going through the conventional training first, right?
I guess I'm trying to understand from I have a good friend who's a human naturopath, and in Illinois, naturopathic doctors are not licensed. So she has to work through her doctor. She has a doctorate in chiropractic as well. So when she is making treatment recommendations or, herbal recommendations, she uses her doctorate in chiropractic. And so it's like these letters have become so important. And I really have been humbled by the number of people who just have a passion and spend so much time trying to figure out how to fix a problem because they're not getting answers. And I feel bad. Exactly. And I feel so badly that they've had to go through it that way. But I would not have been a good resource back in 2015 when I graduated, because I didn't know what to offer people. And like I said, a series of events that happened just really, really changed my mindset. And there's a time and a place for prescription medications. And for some people, I feel like you can't convince them to go the holistic route, to do the herbs and the acupuncture, to use diet change, because it is a lot of time. There's a money investment as well. There's some confidence that you have to develop yourself, and not everybody wants that. Some people just want to be told what to do. And so I think there'll always be a little bit of both. I just feel like I'd love to see the pendulum shift towards more of that natural approach, where you don't really need a veterinarian. You just need a team of people who understand health and can help you apply that to your pet, because
that's the future. I love that you're saying that, because that's already a thing in human health. There are human health coaches. What the hell is that? Well, Dr. Ruth Roberts, one of the vets I told you have been practicing for 30 years, has started the same equivalent for health pet coaches. So she just launched her program. If you're a vet for a vet tech. You get 40 CRE credits going through her program. I'm her cannabis and mushroom teacher, so I'm very excited about that. But I love that pet parents like myself, vet techs, anybody who is interested in animal health can literally become a health coach. And that's where I see the future, where, you know, they'll be able to talk to people, a pet health coach who will be like, okay, yes, let me reach out to Dr. Ruth, or let me reach out to Dr. Beaird and see, kind of like how I do. I have an issue. I text my board of advisors and I say, what do you guys think? And it's really funny because I get to take all of their opinions and advice and mesh it into one and then make a decision. But that's kind of how it will be. You will have these different options and they're kind of like this cheerleader and coaching you through the whole process, which I think is a great thing, will be the only thing that helps us through this extreme shortage of veterinarians, especially the good ones.
Yeah, and it's so appropriate to start integrating that kind of care before your pet has a problem. And I think that's the hard part. So many people find they want a holistic approach. I just had a client come in with a dog with degenerative myelopathy because our vet said there's nothing they could do.
I was told that with Odie at age 9. That's why I created the yeast tincture.
Yeah. Yeah. And it's amazing to see, like, well, to hear that and be like, I wasn't quite that like blunt about it. I said, we can try some things, but there's not a lot of research. But then you get into the integrative world and this dog has been holding steady and slightly improved since symptoms started in October. And we're doing a lot of things. We're doing acupuncture. We're doing chiropractic. We have herbals on board. We have she swaps between ease and heal tinctures, change the diet. She's doing additional turmeric and other supplements to kind of support this dog. She's all in. And she also has a line. She's like, I will not, once she gets to this point, if she gets to this point, if this is the disease that's going to take her, I'm not going to put her through that. And I look at that and I'm in awe of this woman, but she's like, I wish I would have known this from the get-go because I would have tried to prevent this in my dog in any way that I could have. I would have tried to reduce the inflammatory load on her body so that at age 10, she wasn't suffering from this degenerative disease where she's losing the ability to walk.
I love that you said that because it's exactly when I went through my, Nina, my Doberman with osteosarcoma. I said, look, if 1 in 4 large breed dogs is going to get this horrible, painful, aggressive cancer, can I start suggesting we give, large breed dogs a full spectrum hemp extract at a year old? So this goes out to my board of advisors who are mostly holistic and integrative veterinarians. Aren't you on it? I know I want you on it. I was like, I'm pretty sure we have you on it now, finally. She was having babies, guys. That's why it took us a little while to get her. But, well, you're about to have a second baby. Yeah. You have one baby.
Yes.
Anyway, what was I asking them? Asking the board of advisors about giving the dogs.
If you can start large breed dogs.
They all said,
full spectrum.
Start giving it to them right as puppies. Yes. Why not? Prevent that inflammation. We already know it's safe. When we look at why children or kids shouldn't smoke marijuana or do marijuana in their young age is because of brain development. That's the THC. There's not enough THC in a full spectrum hemp extract to cause that issue. Right. And we now suggest all large breed dogs or even dogs that are prone to certain awful cancers or diseases. Give it to them so that's exactly the thinking. Keep that inflammation down and help support the immune system that entire time so that hopefully that disease never, if it does surface, it's not what's going to kill them or hurt them. It just kind of exists and we're maintaining it.
And you don't have a way to compare to what it would be like if we didn't do those things. But in my mind, what we need to really focus on is there's things that are totally out of our control, environmental toxins, things that we can't control. People spray on their grass. And that doesn't mean your dog should never go for a walk because there's risk benefit to everything. But we also have to be mindful of not overloading the system. So like, what do you do to really that you're going to get the biggest overall health span without going crazy? Because I've had people come in and they've got 56 different supplements, essential oils, flower remedies, homeopathy, like all these things. And I'm like, oh, can we look at the diet? Let's look at the big thing that you're doing every day. And then let's look at something that's going to influence multiple systems in the body rather than just focusing on one. And then build from there depending on what your pet is going to have problems with. I would love to see breeders do more of this stuff, because that's where, obviously with shelter animals, you don't have that type of control, but seeing more and more breeders start to be mindful of how they're feeding their dogs to create healthier genes. And so that what is expressed as puppies is already, I guess that's getting in kind of deeper stuff there, but there's a lot of generational effects that we can start to change. And some of those, I just hope that some of those over time will help. It's just devastating to see the number of pets that are getting cancer. I mean, my dog had it 3 times before he passed from it.
Wow.
And it is like a huge, he was my best teacher. I should have paid him the money I paid vet school because I learned so much more from him. But it is, once you start listening to what people or what pets really need, it changes. And there's a lot more proactive stuff that you can do early. Yes, your investment up front is maybe a little bit bigger, but man, in the long run, it's going to be worth it.
That's what people don't understand, is that, dog feeding like a kibble diet, for instance, is it's like a slow kill, a slow degeneration that is going to rear its ugly head when they when they become seniors. It's usually when that disease or skin problem or lameness or whatever it is starts, rearing its ugly head. It's because Odie was 9 when he did his leg thing. And it's so funny because he was diagnosed with degenerative myelopathy. And then when I went to see what I could do naturally, I couldn't find anything. And so when I learned all about cannabis, I was like, oh yeah, I'm making him a tincture. I have no idea if he was misdiagnosed, if what he had. I never saw it again, what he was doing. Now he has severe lameness now. He's like wobbly all the time now. But I only saw like he was like kicking out his leg uncontrollably, and I could tell he wasn't in control of it. So last time, the chiropractic, I did acupuncture. I gave her heel extract, and I never saw it again. And literally last year, it happened again. I just went through the same process and again went away. So I don't know what the heck it was, but that's what a vet did. I've been, diagnosed so many different things that I'm just, believe the diagnosis, but not the prognosis. It's like, thank you for the diagnosis. Now I'm going to figure out what I'm going to do and find the natural way to help my pet instead of making things worse or loading him up with pain meds. And I know he wouldn't be here still if I had gone her route.
Yeah. And the other thing that I've kind of learned too is a diagnosis is still just a symptom. It's a symptom of the body saying, I'm out of balance. Please help me.
Oh, I love that.
Get back. And that's it's a hard thing to do because that's not what we're taught in veterinary school. What I was taught is you manage allergies, you manage diabetes.
Wow.
You manage arthritis. Like it's something. And when you say that, I mean, that's a kind way of saying these clients will continue to come back for their insulin, for their Rimadyl, for their whatever, and you will have a forever client. Especially with allergies. I mean, I've since moved out of Chicago since I was practicing a bit more in like more conventional settings, but I was seeing allergies at 8, 9, 10 months old. And I'm like, well, what in the world has this puppy been exposed to compared to the dogs I see in the suburbs? So many of them do doggy daycare and are required all these vaccines that are not necessarily appropriate for their lifestyle. And I could not, I've never, and I haven't seen it since back in the suburbs, and I'm not seeing it again. And it's just like, in some ways, are we causing some of this by failing to look at all of the potential, the goods and the bads, and trying to figure it out? That's not really how we're taught in school. Or if it was, I really misunderstood what the professors were telling us. It seemed like this is how you manage this. This is what you'll do for the rest of the pet's life. So you're really not
looking for the cure. You're just managing it.
No, cure is not a word that is. every once in a while oncology, you would hear cure. Like,
are you allowed to say remission?
Yeah, yes, yes. But cure is just not, a lot of times it's even if an animal is like hit by a car and needs some orthopedic surgery, they're going to have long-term arthritis from where that injury was. And instead of looking at, even things like physical therapy were minimized in school, even though we had a rotation with it. Like, we had a whole section of our hospital dedicated to it. It was never really discussed how important it was.
Yeah.
So there's I think a holistic approach still isn't throwing a ton of herbs or natural remedies at a pet. It's this lifestyle, and it goes beyond the clinic. It really does start at home, with like good interaction with your pet and getting outside with your pet and doing the things your pet loves. Because we think about ourselves, if we're not doing things we love, we start to get depressed. We don't feel so great. And then that's an opportunity for the body to get out of balance. It's not, I feel like diseases are not, people have a hard time connecting, like you're saying, kibble with a chronic or an issue that pops up later.
Right.
But most diseases aren't like Amazon Prime delivery. They don't happen like within a few hours of the incident,
right,
short of like getting hit by a car. It's this insidious process that's happening.
And there are warnings. And there are bumps that pop up that vet will just chop off. And that's what's amazing, I think, about dogs, is that everything pops up in the skin and goes, I got an issue. Do something about it.
And then it internalizes. If you're not going to do, and Finn's first cancer was very external, and quote unquote cured by surgery. But as I started to evolve and change things, but there's 6.5 years of mistakes I made with this poor dog who came from a very traumatic experience before I adopted him. And I think all of that plays in.
Absolutely.
And it's not always, we don't have all of the answers for every pet, how to remedy and balance everything, but it's still a great learning. He was a great teacher, and I'm sure you feel that way about, Nina and other pets that you've had too. That's why you do what you do.
I literally have created my products to help my animals that I take care of. Because I couldn't find anything. I would go, or if I would learn about something and I couldn't find it made correctly, or they added extra ingredients, or was it potent enough, or whatever it is. What's your opinion of why you're not taught about the endocannabinoid system in school, which is now known as the master system of our bodies that's in control of all of our other systems? And when something is off, it is its responsibility to bring us back into homeostasis. So this is the most important system. There's now been like 6 or 7 endocannabinoids that have been discovered, where there are these other actions that are happening in our body that we know about, that they're now going, that's the endocannabinoid system. Oh yeah, that? You know about that? You know about FAAs? That's the endocannabinoid system. So I'm becoming real cool now that they're finding this type of research. But why do you think that you're not taught anything about the endocannabinoid system? Because it's named after cannabis?
Well, that probably is part of the problem, especially when I don't know if things have changed since the Farm Bill went through. I graduated before that. I highly doubt it.
It doesn't.
But the people teaching, I didn't have a single practice. There was one of our anesthesiologists did do acupuncture. And in hindsight, I remember watching him, and it was a very like Western approach to acupuncture. It wasn't really looking at the system and how it would be influenced. So we didn't really have anybody who thought beyond very conventional medicine. And I think it's extremely complex. It's extremely integrated, and it also, I think, if you balance the endocannabinoid system, you don't have other problems to manage for the rest of the pet's life. And I don't think, frankly, some of it is just, I probably, if I've said it once already, but when you're inside of a box and you don't know you're inside of a box, how in the world do you think outside of the box? And this is a curriculum that's been put into place and approved, and I just don't think it would fly. There was an integrative veterinary club, and in hindsight, I wish I was part of it to know what I could have could have learned and saved myself 3 years of misery.
And
because I was a very unhappy vet. I was very unhappy.
And those clubs exist in just about every school, holistic and integrative
Yes.
clubs. And guess what, folks? Those clubs are the ones that invite me to come speak, because the schools don't invite me to come speak, but the students do. And they come on their lunch hour, which gives me hope. Come on their lunch hour to come hear someone talk about the endocannabinoid system and cannabis and mushroom medicine. And that's a beautiful thing. And those are the students. Those are those good ones we don't want to lose. And that's why we need to support them so much. I think we're out of time. And I, again, enjoyed my conversation with you so much. I cannot wait to see what you're going to do, because I know you're going to make such an impact. And I want to thank you for being one of those good ones and figuring it out, and being another vet that's going to empower us pet parents to figure it out and trust our gut and know what to at least walk into when we're walking into a vet office of, no, I don't want that. Yes, I want that.
Don't be afraid to you're hiring your vet. Never be afraid to speak up. And if they're going to get defensive, that it's not the veterinarian for you.
Right. Move on.
And frankly, you might not even need a veterinarian. There are times where you do.
Yeah.
You absolutely do. But more often than not, if you have a really good pet food store that is really advocating for species and moisture. I learned so much walking into those. It was very humbling the first time I walked into one, and they started talking about Dr. Karen Becker, and I was like, who is this woman? She's part of the reason. She's who I reached out to get into the integrative world years ago.
Awesome.
And so it's a small network. Hopefully it continues to grow, and hopefully we also, as veterinarians, recognize the importance of everybody that is working towards the same goal. It's not about the letters behind the name. It's the passion that people have to bring health and healing to pets.
Yeah, there's too much to know, and we can all learn from each other. Absolutely.
Yes, it takes a village. It does.
Do you do online consultations? Can people go online and
not yet?
Not yet, but soon.
Not yet. I'm going on maternity leave on Monday.
Awesome.
But I am working, hopefully my platform will launch in midsummer, and then I'm working through the legalities of doing some consultations, but I will definitely have a course that will become available by the end of this year.
Just call it a coaching session or a consultation. You'll be fine.
Yes. Yeah, you can't. I've already talked with the Illinois board.
Okay,
They're very nope, you can't. I cannot call myself, I'm veterinary trained, but not a veterinarian. I can't be your veterinarian when we're talking online. I will have those options available on my website once that launches, but I just figured it needs to come after the baby, because I can't support people and figure out how to do two two-legged ones at least.
That's right. Well, we're glad that you're doing that. And I want people to know that that's what I do. So if I have an issue, I will go to I have a trusted emergency vet that I like, that I'll go get the blood work done, whatever my team tells me to do, and then send them the results and go over it. So that is something everybody can do. If you cannot find a vet that you love and trust, this is something that you're able to do. Thank you, Lauren, so much for coming on. I really appreciate it. And congratulations on your new baby. I hope everything goes awesome. And I can't wait.
Thank you.
Till you're back, and we'll talk to you again in a year and see what you're up to next.
Yeah, let's do it.
Awesome. Thank you.
Great. Have a good one.
You too.
Bye-bye.
Bye.